we're going to spend somewhere between 2 and 2.3 trillion this year, next year on health care. That's up from $1 trillion 6 years ago. I don't subscribe to the notion there's inadequate resources in the health care issue. So I'm not one who believes a tax increase is necessary here. We spend, for every health dollar spent globally, 50% of it is spent in the United States. So it's not a question of how much few dollars being spent. It's where it's being spent, in my view. I subscribe to the universality approach, prevention, expanding Medicaid, Medicare, and dealing with the information technology stuff, 34%, all of those things. What's missing here is not the formulation to do this. What's missing has been the leadership to bring the stakeholders together to get it done. The answer on healthcare is not A to Z. It's about A to D. There's not some magic formula floating around in the ether that no one's thought of yet that's going to reduce cost or stabilize cost and increase participation and relieve people from the fears and threats of having a catastrophe befall them because they don't have the coverage to protect them. And this is a problem that's not going to be solved by one party. Most of these issues are not going to be solved by one party. And it's what I've done for 26 years. When I deal with Orrin Hatch and Jesse Helms and Dan Coates and others on every major bill I've written, it wasn't because I was just dying to. It was because I knew these things weren't going to happen. There'd just be a series of speeches and nothing would get done. And health care is one of those issues that's going to take political cooperation. And we all have a pretty good idea of what the limits are that we have to work on. But the one issue that we're really not talking about is the incentive structure under health care. And as long as we don't change that, then this isn't going to, we may flirt on the edges with this, and the price and the cost will continue to go up. We're over-medicated, we get over-operated on, hospitals survive by how many patients they have and how many operations they perform. It's all cost-driven. The incentives are all cost-driven. So you've got to begin to incentivize this differently if you're going to stabilize these costs. So instead of being 16% of our GDP, it could be 20 or 25. Very quickly, when it's $1,500 per GM automobile is the health care cost per car, which is in excess of what the steel is in that automobile. And Toyota, it's $150 a car. The issue goes far beyond just health care. It's having a huge economic implication. The preventive stuff, 49% of the schools in this country have exclusive contracts with soft drink companies and junk food companies. And you wonder why you have an obesity problem and a growing juvenile diabetes problem. Again, it doesn't really fall into the healthcare structure.